Hello, my name is Morgan Canal, and I'm with Feed Your Genes. I'm here today with
Dr. Penny Kendall-Reed from GeneRx.ca.
now Dr. Penny. I've been a little bit hesitant to talk about immunity because it's sort of all people are talking about right now. But I also feel a little bit of a responsibility to talk about immunity because I see that people are really starting to take their health seriously now, and they want to get in control of having a healthy diet, taking in the nutrients that are going to work the best for them. And really, that's genetics, right? Like, that's really where we can talk about genetics. So, talk about nutrients, foundation, and genetics with
Mhm.
immunity.
So I feel exactly the same as you. It's such a touchy topic right now, but it's such an important one. I see so many people and so many patients emailing me saying, I'm taking high dose zinc because I know zinc is great for my immune system, and I'm also taking some echinacea. And is there anything else I should be doing? And the caveat, as with everything, it comes down to our genetics. So if you code normally for the absorption of zinc, so meaning you take zinc out of your food perfectly well, and it transports across the membranes really well, bumping your zinc up on a daily basis all the time is just going to deplete your copper. And then you're going to run into some problems there. And we also see, and this is with everything. So what parts of the immune system do we need to stimulate? We don't want to just stimulate everything. So echinacea really increases white blood cell count, but that in of itself can be inflammatory. And if you heard our last detoxification little mini cast, CYP1A2, one of our detoxification genes, they're not so good with echinacea, depending on how you code. So it's actually going to increase the inflammation. But we all see with friends or family or our patients and clients, there's that person who's getting sick all the time. They catch every cold and flu that's going around. And then there's those people who, like, they seem to treat their body so poorly, they don't sleep and they don't get anything. It comes down to our genetics. So one of those genes, IRF5, this is a gene that talks about when a virus or a bacteria enters the body, how quickly does your immune system see it and mount a response? If it doesn't see it really quickly, as the variants won't, then that virus or bacteria starts replicating and replicating in the body, so the symptoms get bigger and bigger, and the infection gets bigger and bigger. If you're normal for that, your immune system sees it right away and possibly even gets rid of it before you even know. Then there's different genes like the HLA-DPQ8. This is a gene which talks about stimulation of autoimmune antibodies. And so is that the part of the immune system that we want to trigger? We don't want to just throw things at our immune system. We want to throw the appropriate things at our immune system.
Exactly. And it's such an important time for us to truly understand what's going to work for us through our diet and what we need to supplement with. So let's say you've got two different patients, and one has got those normal positions for the zinc, the vitamin D, a lot of those immune function supplements, and the other person is impaired. But how differently would you treat those two patients?
Massively different. So the person who is variant for the zinc, I'm going to be putting them on 25 to 30, if not 40 milligrams of zinc every single day. And I'm not really worried about the copper, because I know that if I give them 40 milligrams of zinc with their genes, they're probably only absorbing 15 to 20 milligrams of that.
Right.
And the vitamin D person who's normal, they can get away with 1,000 IUs a day. The person who's variant, they often need 4,000 to 5,000 IUs a day, and they need it spaced out throughout the day, not just in one sitting, depending on how many vitamin D receptors they have. So, and that's another part that you need to look at, the number of receptors, because if you give it all in one dose and they have very few receptors, you're basically wasting out half of the vitamin D there. So it really changes what nutrients you use, the dosing that you use, and how we truly think about our immune system.
And, speaking of vitamin D in particularly, because I don't think people really know that there can be such a thing as maybe too much, or if you absorb it efficiently or not. When I first came to see you as a patient years ago, I was taking, vitamin D with my fish oil. It was in my multi. It was in another supplement of mine. And, I had tested my blood to see how are vitamin D levels doing. and I was way off the charts, out of in toxicity levels. And you and I looked at my genetics, and I'm very efficient at
You're
absorbing vitamin
extremely efficient.
D. So, it's important for us to be able to get these cues from people so that we can support them in a time when immunity is such a big concern to them.
Exactly. You're exactly right. And you're a perfect example of how what we look at as such a benign yet important vitamin in the body, how too much can create that chaos.
And what about those immunity genetics that we talk about? Someone's able to fight off the common cold, someone's not able to. How does that differ? How we're able to support them in your practice?
So somebody who doesn't identify that virus or bacteria really well, for instance, right now with a virus that's going around, I'm going to give them something like an olive leaf extract that's actually going to block that viral receptor and stop it from binding in. I might use something like a plant steranol, a Moducare, to help regulate out the antibody production against a bacteria. If it is an autoimmune side, then I'm going to go, whether it be a quercetin or a catagen type substrate, that's going to regulate out the autoimmune antibodies. So there's all sorts of different nutrients that we can use depending on which part it is. And again, looking at the integration, we also have to look again at inflammation, because inflammation is going to certainly impair the immune system and accelerate the speed with which a virus or a bacteria replicates as well. So we need to go back again and look at our interleukin-6 genes and our TNF genes and our detoxification genes, see where is all this inflammation coming from, and get that down too. Otherwise, what we're doing in the immune system is just going to be sort of kiboshed by all the inflammation.
Exactly. Well, that's why I use the GeneRx report for everyone that comes to see me, so that I can really look at the integration of all of that and give them some really good protocols that will cover all grounds. And, just to finish off on this, I know that a lot of people are scattered in, I want to get healthier, I want to get in front of this, how do I do this? And to be honest, my number one suggestion is go get a 23andMe kit, test your genetics, and find a practitioner who is using reports like the GeneRx report that can really support you in all of those different body systems to get you the best results.
We have to get back to our basis. We have to look at our foundation of our health. As a natural healthcare practitioner, the first thing we're taught is stimulate the innate healing response within the body. Well, how do you know what the innate healing response is if you don't know your genetics? You don't know what your innate genes are saying stimulate here and not here. And, we all think that we can eat one way and be healthy, and you can't. You have to take what your genetics say. I need more protein, I need less saturated fat, whatever it might be. And then what I love that you do with Feed Your Genes is marry in the inflammatory detoxification side. So you take it beyond just the dietary genes into the entire body and what that individual needs. And that's the basis of immunity.
Mm-hmm.
That's
Oh,
the basis. That's the basis of health.
that is so good. Well, thank you very much, Dr. Penny.
Thanks
And
for having me.
we'll get back at it soon enough.